Why does this team do this? Why do they want to volunteer and help out in a crisis?
Whew. You know, that's a question I often I ask myself. But to know these people, they just love their community. They love their families. They're all about taking care of each other. It's a sacrifice, you know? Emergency response phone. I'll be alerted to an incident that's occurred. I will make a phone call to one of two people on my first response list and let them know how many people I need. This is what I have going on.
We just got notified by the nurse that there's 2 women at a construction site bleeding. They're screaming, so we're heading over now. We don't know much more.
And right now you're doing your massive Hendrix, so do all the
Once first responders converge on this accident, somebody assumes incident command.
That's...
Okay,
Put your hands down. And Phoebe, do you remember what day it is?
Thursday.
Thursday. Okay.
Sorry, lady. On 3. 1, 2, 3. How are you doing, Jen?
Then you don't have to try and go down.
The incident commander is calling me and updating me so I can have fluids, IV, bear huggers, whatever is necessary, ready when they get here.
Alright, I got you. I know there's a left laceration at all.
The injury was a saw blade to the left arm. We found arterial bleed in the left arm.
Her unwrapped, let's get vitals on her. I need a heart rate and a blood pressure.
So when there's multiple people involved and there's just one of me, it's very easy for me to say, okay, wounded arm, stabilize that arm, get vitals, do a secondary assessment. And these guys are already, you know, tuned into doing that.
Grab the tubing out of the drawer.
Bernadette,
How far do you want me to go with alcohol? I put the retractant.
So I've got a vein here that I cleaned that I could go for,
Okay.
but I'm not going to.
On the 15th of every month, thereabouts, I'll go out and I'll set up a scenario that's, you know, likely to happen here.
All right, let's get you warm clothes. Let's go upstairs. Let's eat.
Tonight we did a training scenario where my wife was injured on a job site at our personal home. We get there, we assess what's going on, check out the scene, make sure it's safe, and start the breathe, stop the bleed, and get ready to leave.
First week of November in 2022, I received notification that I was going to be a one-person clinic in 10 days. No front desk, no janitor, no other advanced practice nurse practitioner, no nurse, just me. And I knew in that moment, how am I going to take care of a trauma patient? How am I going to do CPR? I can't start an IV and pump a chest. So my mind raced. So of course I reached out and said, anybody who has medical, wants to learn medical, come to the clinic on Saturday. When I made that initial call to the community to say I'm one person, I had 21 people show up here at my ER. That was like beyond what I could have ever imagined. I promise you every month we will learn something and we will teach you so that we can save each other, because otherwise it can't happen with just me. January 1st, Eric Opeland scheduled the first woofer course and 13 went through that course and were certified.
We had 13 people get certified as wilderness first responders last January, and we had decided at that point that we wanted to keep our skills honed.
And Eric Opeland, he's just kind of assumed the leadership role, and he always talks about muscle memory. He said, if we don't do it, we're going to lose it.
A lot of these skills are perishable skills, so if you don't use them, you lose them.
So every month, you know, he orchestrates a mock scenario in the field with a snowmobile or an ATV or a truck versus tree.
This last winter, we would go out and cut holes in the ice, and then we'd actually have volunteers get in the water, but it added a sense of realism because they literally had patients that were potentially hypothermic at that point. So their training took on a completely different feel when they knew that what they were doing was serious business.
The major hurdle that I think we face here is the lack of emergency medical service, the ability to get somebody who's critical to an emergency room in a timely fashion that, you know, we're used to in the lower 48s. Our first response team is 100% volunteers. These are people that, you know, I reached out to and said, you know, I can't do this by myself. And for their love of family and community, they said, I'll step in, I'll learn. It makes a big difference. It makes a huge difference.